Hi, and welcome to Integrative Cancer Solutions with Dr. Karlfeldt. A cancer diagnosis is one of the hardest slap in the face imaginable. All of a sudden, you have to become an expert in cancer and its treatments because your life depends on it. Oncologists, family, and friends are pushing you towards chemo, radiation, surgery, yet you feel there are additional solutions out there. You don't feel confident in that only traditional therapies will take care of it. You may, as I have, seen family or friends quickly go downhill from harsh medical treatments. There is a better way. I invite you to listen to stories from real people fighting cancer successfully through powerful, integrative, and holistic methods. Learn what they did. This is my gift to you to make the learning curve less steep after your diagnosis. The information in this podcast could save your life as it has others. Welcome everybody to Integrative Cancer Solution with Dr. Karlfeldt. I'm doing a continuation of my last week's episode. We're talking about the fundamentals of cancer care. I talked a little bit about the mental component and also about the 5 basic elements, how to balance the body, our air, water, earth, spirit, fire, those, and what we can use in order to be able to support those different components, how important it is to make sure both our internal and external environment is taken care of. So I mentioned, at the Karlfeldt Center, we have a 2-week photodynamic therapy protocol. People come in for a couple of weeks and we give them a huge amount of different therapies that are very, very useful. And the core component of that in regards to talking about light, obviously without light, we can't exist. Without sun, we can't exist. And actually light is one of the biggest deficiencies, I would say, that we have, because most of us live, we're inside a lot. We don't enjoy the sun as much. And when we're in the sun, we don't expose our skin in the way that we should to the sun. And I believe that is a huge reason for a lot of diseases, because we don't get fueled up by that light. So we're actually light deficient. And they have seen that the people that they've actually seen that cancer, if you are exposed to light, the areas on your body, you're less likely to develop internal cancer. Obviously, there's a risk of skin cancer, but if you support yourself with a good amount of antioxidants in your food, and also supplement yourself with antioxidant, that you're then able to protect your skin from the skin cancer to a high degree. Obviously, you can never say that anything can prevent, because you never know. It can be preventative, but you can't say that it can prevent. Because there's so many factors involved, and cancer may appear even though a person lives a perfect life. And next week you'll hear an interview with Kathleen McCarthy, and exactly that. She did everything perfect, eating well, exercising, and still developing cancer. So you never know. But the core piece in this photodynamic therapy is obviously photo, and dynamic, meaning that it has a very it's a very dynamic aspect to it. And photodynamic therapy, it's something that's clinically proven. It is minimally invasive, and it can actually exert then a very specific targeted cytotoxic activity towards any kind of cancer cells. And so what this procedure involves, it involves in using then a photosensitizing agent. And the photosensitizing agent, in my case, the strongest one that I've seen that lasts the longest in the body, it's a dear friend of mine, Matthias Wolczek. He's at a university in Germany that created this photosensitizer, and it stays in the body for up to almost like 2 weeks. And so that means that you can infuse it, and then you can continue to treat the body. And so the photosensitizing agent, you introduce that and you follow that with irradiation then of a wavelength that corresponds then to that absorbance band of the sensitizer. So the nano-ICG, for instance, that one is the wavelength band that it corresponds to is in the infrared. So you would introduce a photosensitizer, and then you would use infrared to activate it. And what is great with this photosensitizer is that it accumulates in the cancer cells. So because of the specific vascularity of cancer cells, it's kind of like honeys to or bees to honey. It's very, the cancer cells are very attracted to this nano ICG, and also because of the vascularity of the cancer, it's leaky. So it allows then these larger molecules of the ICG to be able to enter into the cancer cells, but it's not really able to pass the blood, the walls of normal blood, so to say, blood vessels. So, and also then we combine that with things like hyperbaric oxygen therapy, another machine is called a Hockett, some oxidative therapy. And so that we can then make sure that the cancer has oxygen in it, so that we can then photosensitize, so we can create then, as we introduce in the light, and it becomes a very strong concentration because of the presence of the photosensitizer in the cancer cell, and also you have oxygen there, it triggers then a production of peroxides or reactive oxygen species that helps to oxidize and the cancer. And so you have clinical studies that show that PDT can actually be curative, particularly in early stage tumors, and it can also prolong survival in operable cancers and significantly improve quality of life. So it has a huge amount of potential. Obviously, there's no therapy that can say we can cure everything, but PDT, photodynamic therapy, is a really exciting new therapy because it is safe. It is safe, and also it is very targeted towards the tumors, and at the same time, it's restorative for tissue that does not have cancer, that's non-cancerous tissue. And so it has a minimal, so it actually greatly then reduces long-term morbidity, and then also kind of a lot of different new technological improvements. And we continue to improve our techniques, and I work alongside with doctors throughout the world to make sure that we make this as efficient and as effective as possible, so that we can support our cancer patients in a way that there are solutions available, because a lot of times, chemo, radiation, and surgery, it only goes so far. And obviously after having done those therapies, then your body is in a weaker state. So it is nice to then be able to have an alternative solution. So kind of go through again the basics of photodynamic therapy. You have the photosensitizer, you have the light, and photosensitizers also, like curcumin, is also a photosensitizer. St. John's wort, would be a photosensitizer. Also a supplement that we use, that we can do both oral and intravenous. Poly-MBA can be used as a photosensitizer. So any agent that's able to kind of pull light towards the cells, that has a certain kind of wavelength band, can be used as a photosensitizer. Some are stronger than others, and it just happens that the nano ICG, nano just means the small particles, so they're small enough to enter into the tumor, but too big to pass through the wall of the blood vessels. So the basics of photodynamic therapy is you have a photosensitizer, then you introduce light, and we use a true laser, which means that it's coherent light, which makes it much more powerful and it can penetrate deeper. And also then we have oxygen. So those are the three, photosensitizer, light, and oxygen. And by combining those three, you can then create that oxidative effect on the cancer. And none of these individually are toxic. But when you put them together, then initiates that photochemical reaction that culminates in the generation then of these a highly reactive product termed single oxygen, or what they call then a reactive oxygen species. And that happens then within the cancer cell. And the healthy cells just get the benefit of the laser light, of the intravenous laser light and the oxygen, which actually turns on the mitochondria and speeds up the repair of that tissue. And it's anti-aging, it kills off, supports the killing off of pathogens, tissue repair. And so the anti-tumor effect then from the PDT, it comes from three different interrelated mechanisms. You have then the direct cytotoxic effect then on the tumor cell. We were talking about that creating of the reactive oxygen species. And then also you have a damage to the tumor, the blood vessels that go to the tumor, so actually shuts down the blood supply to the tumor. So we starve the tumor in itself. And then also it has an induction then of a strong inflammatory reaction that can then actually lead to development of a stronger systemic immunity, to actually boost your immune system that way. And then also you have, in addition to the creation of the oxygen species, to create that oxidative stress within the tumor, you also have a thermic effect. I mean, it's an overheating effect of the cancer. So you kind of create the reactive oxygen species, and then also you cook it. And cancer cells can only handle a certain amount of heat, and then they die. So now you're killing it in both ways. So it's almost becomes a thermo ablation of the tumor tissue, and so you could call it photothermodynamic therapy, in addition to the photodynamic therapy. So you can have that thermo effect as well. So I mentioned the different photosensitizers. I mean, the one that I use the most is nano ICG, and that one connects to infrared. But then you have things like methylene blue, that connects to the red laser spectrum. And then you have riboflavin, which is just vitamin B2, and that connects then to blue section. You have hypericin, which is also known as St. John's wort, so you can do that orally, and in some places it exists also intravenously. And that one connects then to yellow light. And each color of these laser colors, each one have different effects on the body, in addition to its activity to kill off cancer cells and to go after different pathogens. And then you have the poly-MVA that I spoke about. It actually has a wide range of colors, so it has a blue, green, yellow, red, infrared, and also ultraviolet. And curcumin, which is from turmeric, if you do that orally intravenously, that would be blue light that you would combine that with. And the laser, can be introduced, like we do at our clinic and a number of other clinics throughout the world. You can do that intravenously, so that you actually treat your whole blood volume as you have it inserted in your veins. So every time the blood passes by, that blood gets treated. So, and the blood passes by one spot in your arm, that one spot in your arm about once every minute. So a 60 hour, that'd be a long treatment. 60-minute treatment, that means that you would treat your whole blood volume about 60 times. So it just shows how powerful that is. So that's when you do it intravenously. Then you can do it also with ultrasound guided. And that's when you then kind of stick the needle, ultrasound guided interstitial therapy. So you stick the optic needle, into the tumor, close by the tumor, and you have you kind of check them with your ultrasound, make sure that you have the appropriate location, and that becomes that way you can kind of get a stronger effect right there where the tumor is at. You can also do it external, and if you have strong enough of laser, you can then penetrate very deep, and so you have it like a shower head that we use, or you can. We also have a little hat, laser hat, where you can Also have a laser watch, so you can, it's a home device that you can bring home, and that way you can treat yourself at home and don't have to be dependent on do it intravenously all the time. And our center also, we have like an 1800 watt laser bed, that it's infrared and red. So that just kind of brings that extra juice, that extra power. And the different oxygen therapies, I mentioned the hyperbaric, and or the Hocket. Hocket actually combines, in addition to the ozone, it combines also a bunch of other therapies like carbonic acid therapy, whole body hyperthermia, far infrared therapy, steam sauna therapy, electrotherapy, ultrasonic therapy, oxygen breathing, phototherapy, aromatherapy, and all of that takes place at the same time. But you can also use intravenous ways of introducing oxygen, like hydrogen peroxide, ozone IV. Those are ways to do it as well. And so common IVs and that we use during this protocol would be like artesunate, vitamin C, and we usually combine that with DMSO to have that extra kind of driving effect. We can drive things deeper into the tissue. The ozone IV, mistletoe, you can do that intravenously. You can also administer it subcutaneously as well. Curcumin, poly-MBA, and DCA. So these are common therapies. And what's amazing with these different IVs, take artesunate, for instance, it combines, we think, like artesunate, that another name for it is wormwood. So it comes from the herb wormwood. And for a lot of people that do kind of herbal antiparasitical, then they know, common combination when you go after parasites is like wormwood, clove, and black walnut. And so, but we look upon herbs kind of thinking that, well, they can't be that powerful, not as powerful as like chemo, but we don't recognize how really powerful these different substances, these natural substances are. We know that artemisinin or artesunate, different names for a similar component. It's actually activated by iron. And cancer cells accumulate iron, and iron is an essential cofactor actually for cancer cell proliferation. So that's why you don't want to take a lot of iron if you're dealing with cancer unless you are anemic and really need it, because it actually feeds cancer. Both iron and copper, tends to really kind of feed cancer if you do a lot of it. So what happens is that the artemisinin, and it creates a peroxide bond that's activated by iron, and that creates an hydrogen peroxide within the cancer cell. So, which means that it will then also create these kind of oxygen, these reactive oxygen species, so to say, within the cancer cell, just the artesunate in itself. And actually the vitamin C functions the same way. It actually triggers the production of hydrogen peroxide within the cancer cell. So killing off the cancer cell, and becomes very targeted, because normal cells, they have an enzyme called catalase that protects themselves from these peroxides, these reactive oxygen species. But the cancer cells don't have that enzyme. So they can't really protect themselves against the vitamin C or the artesunate. So this is just kind of show how powerful just, a natural herb like artesunate, how powerful it is. And they actually seen that cancer cells are about 100 times more susceptible to die from artemisinin or artesunate than healthy cells. And they've seen that the primary action is a downregulation of something called nuclear factor kappa B, NFKB, which is the master control gene for inflammation. And they also seen that artemisinin regulates P53 DNA repair gene and cyclin-dependent kinases. So these are just things that they see that these natural agents do, and by taking it intravenously, or orally, you will then benefit from all these effects. And P53 is a huge component when you're dealing with cancer. In fact, P53, that gene, if it's mutated, if you have a large percentage of them mutated, then chemo will not work, because you need P53 in order to be able to trigger that cell death switch, to kill off the cancer cell. And if it is mutated, then chemo will not create that, cell deaths that you're looking for. So then you get all the negative effects, but you don't get the kill that you're looking for. So artesunate can then help with that. And it also helps with that angiogenesis, where the creation of blood vessels that feeds the cancer. So then actually then disrupts that blood supply to tumors. So that becomes a really important component. And also they've seen it then slow in growth in cancers and like, fibrosarcoma, lymphoma, breast, pancreatic, esophageal, prostate, ovarian, fallopian, peritoneal carcinoma, and also being effective then for squamous cell carcinoma, liver, hepatocellular cancer, and a lot of other liver metastases, from other kind of primary sources. So it does a lot, and that's the thing, is that don't think that these powerful tools may not be enough. They really are helpful. And then we have like mistletoe. Just want to kind of go through some of the things and just understand how powerful just mistletoe can be. It modulates immune system and it inhibits angiogenesis. It induces apoptosis, which is that cell death switch of the cancer cell. And also inhibit ribosomes and protein synthesis, for the creation of cancer cells, and also, reduce platelet aggregation and cancer extravasation, and improves the quality of life in cancer, and increases your leukocytes, your white blood cells, your lymphocytes and neutrophils and monocytes. And also induces a Th1, which is important because that is the kind of the anti-inflammatory aspect. And it increases, like I said, the CD4 T cells, which is part of the immune system, phagocytosis, which is the eating up of the cancer cells, and also regulates the cytokines and interleukins, and your natural killer cell count and activity is increased. Your CD8, which is another part of the white blood cells, gets increased, activates the dendritic cells. So it's just kind of seeing curcumin. I mean, if you just knew, there's several hundreds of different things that curcumin will do in regard to cancer. I mean, it's really incredible when you go through all these different substances. And I want to just touch on poly-MVA, which I have a large percentage of my cancer patients on, both oral and intravenous. And what's amazing with poly-MVA, it's a kind of an alpha-lipoic-like substance, but it's bound to a certain metal called palladium, and then also it's bound to certain nutrients, like vitamins and minerals and amino acids, and it's actually unique in its own. It's a kind of a unique structure. So it's not that you can kind of separate when you ingest it, that all of a sudden you have alpha lipoic by itself and then these different nutrients by itself, but it creates a unique cage-like structure, and that easily then penetrates cells and also penetrate the mitochondria wall or membrane and it activates the mitochondria in an amazing, effective way. And by doing so, what it does is that it supports the repair of cells that are kind of moving towards becoming cancerous, and so that they can then become normal and healthy. But then if a cancer cell, if it's gone too far, it triggers that cell death switch. So which is a really cool way of treating cancer, that maybe we can then convert see how many of the cancer cells we can convert back to function in a normal pattern. And poly-MVA helps with that. But then obviously if a cancer cell is not able to do that, then it triggers a cell death switch to kill that off. And then you have dichloroacetate, which is another cool molecule. It's actually a very small molecule, and what it does, it inhibits then what's called lactate formation, and it switches your cellular metabolism away from that lactic acid production, which normally takes place within a cancer cell, because it shifts from using the mitochondria, where we would use oxygen in order to be able to produce energy, and we can create quite a bit of energy that way. But it then shifts because a cancer cell wants to avoid that cell death switch, which exists with the mitochondria. It then shifts the energy production towards a fermentation cycle, which then produces lactic acid. And lactic acid is like a signaling molecule. When the cell will then release that lactic acid, the lactic acid will then promote metastases. It will promote more cancer growth in the kind of the tumor microenvironment, or the kind of environment around the cancer cells. Because in a tumor, every cell is not cancerous. It's just a certain percentage. So what the lactic acid yeast or lactic acid, what it does, it actually convert more and more of the healthy cells and normal cells within that tumor into cancer cells, and then also then promotes the metastases, so that some of these cells then leave and try to create colonies in other area. So if we can shut down that process, then obviously we would have a greater chance of surviving, and also be more effective against the tumor. Because they know that, I think it's like 90% of the people dying from cancer is due to cancers that have metastasized. So if we can stop that, then we have a 90% chance of surviving. So and DCA, or dichloroacetate, is a small molecule that you can do both oral and intravenous, and that helps to inhibit that lactic acid, the lactic acid formation, and shifts the energy production back towards the mitochondria instead of that fermentation cycle. The thing with dichloroacetate, or DCA, it is best to combine it with poly-MVA, and because they have seen, if you just do DCA, you may develop some neuropathy with it. If you do experience a little bit of neuropathy taking DCA or doing it intravenously, then simply stopping should then reverse the neuropathy. But if you just keep on pushing, taking the DCA, even though you're experiencing some neuropathy, it can then become permanent, and obviously we want to avoid that. But combining it with poly-MVA, I have not seen that effect, and I speak for many other integrative doctors that treat cancer patients as well. So that's just a really cool other IV that we do at the center, and a good kind of follow-up therapy with people dealing with cancer after having done the 2-week protocol that we do, is doing 2 weeks on, 1 week off, of doing poly-MVA and DCA twice a week. And you do that for 4 cycles. So that's a really kind of cool protocol along with that. But then there are a bunch of other therapies that are really good to do in addition to that. We want to make sure we work on the trauma and the kind of the emotional well-being of individual. The technique we use at our center is called applied psychoneurobiology, or standing for APN. And it's just a way to pinpoint traumas, where they're coming from, what kind of emotions, and using then eye movement, laser, color, in order to be able to then address these stored emotions, so that they don't become a gravity point for cancer, that will then kind of attract the energy of cancer. And then also we believe in prayer. We have a prayer warrior that comes to the center, and she guides our patients and connecting to God and calling on the greatest healing power of all, which is through prayer. And so I think that is one thing that we do when we do other techniques that works on detoxification, working on the lymphatic, with different vibe machine, and something's called flow presso that kind of moves the lymphatic through a computer. These pads that you put on the legs and arms and torso and upper body, and that just helps to kind of move the lymphatic out. Then obviously ionic foot bath with that, and coffee enemas just to help to move these toxins out. And then we do, a bunch of other therapies like peptide therapy, repurposed drugs, right frequencies, and PEMF, shockwave therapy, ultrasound, diets, huge, very, very huge, different nutraceuticals, different supplements. And we use a technique called ART, or autonomic response testing, which is a very advanced form of muscle testing to be able to pinpoint to see what kind of supplements that would be best for the individual, and also be guided by labs. We would do screening labs to see what may be some driving factors. There's a lot of heavy metals, chemicals, mold, other pathogens like Lyme or different viruses. There are food sensitivities that can be causing inflammation and kind of feeding the cancer that way. Also, we can do genetic testing to see then what are some of the foods that would be best for the individual based on their genetics. And so there's a lot going on to be able to then address these the cancer. And something that's really cool is we do something called laser energetic detoxification, which is a gentle, rapid, non-invasive method of addressing things like chemical toxicities, heavy metal, sulfur intolerances, nutritional deficiencies, and so many more things. And what it is pretty much, you have a clear glass, treatment glass that has a homeopathic frequency in it, and then you shine a laser beam through that, and the frequency of that homeopathic vial kind of piggybacks on that laser, and as it then hits the body of the patient, then they get then introduced, or they're given that information, and as we're then kind of sweeping the whole body with that, it's like the body then recognizing this is heavy metal, this is mercury, and then actually starts to then look for that mercury in the body and starts to move it out. And so that's a very powerful way of detoxifying. And we can also combine it actually with, through ART and the muscle testing, you can then test and see, you can use a cancer tissue vial and then see if it correlates with heavy metals or chemicals or mold or whatever. And then we can use two vials, cancer tissue vial, and then the heavy metal vial or the virus vial or whichever one it was that it correlated with. And you do laser sweep with both. And then the body starts to recognize, I need to address, this cancer that is associated with this toxin, and start to detoxify that toxin, and especially in relationship then to the cancer. And so that's a really kind of cool, powerful therapy that we do at the center. And there's a long list of different supplements that we would use, common ones. I mentioned the poly-MVA, curcumin is really powerful. And it's very important which kind you use. We use one that gets into the system really quickly. And that's the issue with curcumin, is its absorbance and getting in the bloodstream. So this one is a little pricier, but you want effect, when you're doing this. And then we do things like dihydroberberine. It's a form of berberine that is easily absorbable. We have fermented wheat germ oil, CBD, pectosol C, transfer factor plus, and BRM4, which works on the P53 gene, C-statin that works on the blood vessel creation, or it kind of shuts down the circulation to the cancer. Different mushrooms like turkey tail, reishi, AHCC, maitake, Quercetin is a common one, grapeseed, artemisia, CoQ10, black cumin seed, EGCG, melatonin, DIM, pancreatic enzymes. So these are just some common supplements that I just want you to kind of be aware of their existence, when you develop your protocol. And all of them are really, each one of them have a huge long list of benefits in relationship to cancer. One of the things that we use commonly is melatonin, a compounded form of melatonin. And they see that in a high dose, and we do up to like 200 milligrams at bedtime, that it really has an oxidative effect, to go after cancer. And so melatonin is much more than just for sleep. So it is a very powerful therapy when you're dealing with cancer. And again, it's a long list of different things that it does in relationship to cancer. And I would invite you to listen to some of the other podcasts, on this and the integrative cancer solutions, then I would listen to Jane McLelland. It's one of the earlier podcasts and talking about repurposed drugs and care oncology, where you use things like metformin and doxycycline and atavastin and aspirin and low-dose naltrexone, and in order to be able to control, to starve the cancer. And common diets, you have plant-based is common. You have keto. We do a keto/GAPS diet at our center. And Kelly protocol is another diet, anti-inflammatory, alkaline. So these are different diets that you can look up in regards to when you're dealing with cancer. And then the different peptides that we use commonly, like thymosin alpha-1, which stimulates the immune system, improves the functional maturation of dendritic cells, which is really important when you go after the cancer. Also, a significant higher killing rate of cytotoxic T lymphocytes. So it activates, your lymphocytes and how they're being able to go after cancer cells. Increases CD4, CD8 count, enhances cell-mediated immunity, increases the efficiency of antigen presenting cells, which means that they will, antigen presenting means that it will kind of grab a little piece of a cancer tumor or a pathogen, and it will show that little piece to the rest of the immune system so that the immune system knows what it's supposed to go after. And so thymosin alpha helps with that process. And then you have GHK copper, which it reactivates in the apoptosis system that's lost in cancer, in addition to suppress the RNA production in about 70% of 54 genes that are overexpressed in cancer patients. So it really goes after that way. Another one that we use frequently is metencaphaline, and it has a long list of what it does as well, inhibiting cell growth and modulates cell functionality, mounts an anti-tumor effect through the regulation then of the dendritic cells that we spoke about earlier, and also increases cytotoxic activity against tumor cells. And so it does a bunch of things. So I would urge you to kind of listen to some of the podcasts prior to. You had Ron, a patient of mine, dealing with metastatic prostate cancer, and his journey. It's just very inspiring to listen to other people, to see what they've done and how they've beaten cancer. And another patient, that we were dealing with, had Debbie with glioblastoma. Within a day, she was able to do things that she hadn't been able to do. Simple things like picking things up, from the floor after first day of treatment. You had Dan listen to his story with mesothelioma, Bonnie with lung cancer. So there's a lot of cool stories, to listen to if you listen to some of the past episodes, and obviously future episodes would be equally exciting. But don't miss out on these inspiring and really cool stories of people that battle cancer and have won. So this is the conclusion of this episode. I know it was a lot of information, but I just want to make sure that we had it compiled in one location so that you could, you had the ability to listen to it. And of course, if you have any questions, please feel free to reach out to to myself at the Karlfeldt Center. You can reach us at 208-338-8902, or just go to our website, thekarlfeldtcenter.com. Take care now. The information in this podcast is for educational purposes only, and it's not designed to diagnose or treat any disease. I hope this podcast impacted you as it did me. Please subscribe so that you can be notified when new episodes are released. There's some excellent shows coming up that you do not want to miss. If you're enjoying these podcasts, please take a moment to write a review, and please don't keep this information to yourself. Share them with your family and friends. You never know what piece of information that will transform their lives. For past episodes and powerful information on how to conquer cancer, go to integrativecancersolutions.com. If you would like to know more about the cutting-edge integrative oncology therapies my center offers, please visit thekarlfeldtcenter.com. Thank you for spending this time with us, and I hope to see you at our next episode of Integrative Cancer Solutions with Dr. Karlfeldt.